Hey everyone, welcome back. Today I am going over some blood work. So I'm going to be talking about a CBC and a CMP. This is a complete blood count and a comprehensive metabolic panel. I'm going to be going over what is included in these tests and what bodily functions these tests are really looking at to help you gain a better understanding of what is being tested. All right, so the first test I want to go over is a complete blood count. So this is abbreviated CBC, and this is looking at your blood cells that come from your bone marrow. So all of these tests can be indicators of bone marrow dysfunction, cancers, and different infections. So keep that in mind as we go through it. I'm not going to list every disease and every condition that can cause a high or low on these because we would be here for a very long time. All right, so first we're going to look at the types of tests that look at your red blood cells. On your test, this is going to be abbreviated as RBC. This is literally looking at the number of red blood cells that you had in the size sample that they're looking at. Red blood cells are measured in millions per cubic millimeter. Your hemoglobin is a protein on your red blood cells that carries oxygen. This is what gives your blood the color red. So hemoglobin is super important. You really want your levels to be up over 12, especially if you're a menstruating female because you're losing blood on a monthly basis. Hematocrit is the percentage of red blood cells in your blood. So a low hemoglobin and a low hematocrit are signs of anemia. Your MCV is your mean corpuscular volume. This is the average size of your red blood cells. Your MCH is your mean corpuscular hemoglobin, and this is the amount of hemoglobin per red blood cell. Your MCHC is your mean corpuscular hemoglobin concentration. This is the amount of hemoglobin in the volume of red blood cells, so very similar. Your RDW is your red blood cell distribution width. So this is the size or the volume of that cell. All of these markers are very, very helpful in diagnosing anemia and the type of anemia. One of the other types of cells made by your bone marrow are your platelets, and your platelets are responsible for helping you to clot. We often see high levels of platelets in inflammation, infections, and in diseases such as irritable bowel disease, which is a disease with a lot of inflammation. And then we see low levels in clotting disorders and autoimmune diseases. When we look at your immune system with a CBC, we're looking at your white blood cells. This is abbreviated WBC. It was probably the first thing listed on your CBC. And this is really helpful in pinpointing what is actually going on in the immune system because it's telling us which cells are overactivated, where we have too high of a production of them, or maybe we don't have enough of them. And that can be really helpful in differentiating between diseases and helping to figure out what is actually going on in the body. So we have our neutrophils, which are our first line of defense in our innate immune response. So we have our innate immune response, which is not trained, it's just the body attacking. And then we have our adaptive immune response, which is what our body has learned to do with specific things. We have lymphocytes, which are divided into categories of B cells and T cells. B cells are the cells that make antibodies. So this is when you get a vaccine, your B cells are creating antibodies. Just like if you get sick with something, hopefully your body is creating antibodies to help reduce the severity of that disease in the future or to help prevent you even from getting it in the future. T cells, there's a lot of different types of T cells, but in essence, T cells can help to kill infected cells. So we look at our monocytes, and we have two main categories in monocytes. So we have our macrophages, which will actually surround an invading pathogen and engulf it. And then we create this toxic enzyme that kills it. And this is called phagocytosis. So it's where our own cell actually eats it and then destroys it. And it does destroy itself in the process. We also have dendritic cells, which are called antigen presenting cells. And dendritic cells basically notify the rest of the immune system of something that should not be there. Then we have eosinophils, which are a little bit more specific to parasites and allergy type reactions. So if you have a high amount of eosinophils, it's likely that you're having an allergic reaction to something. Maybe it's just seasonal allergies, but it could also be a sign of a parasitic infection. And then basophils make up less than 1% of our total white blood cells. But basophils are a type of granular cell, and they contain histamine and can release histamine, which creates part of that allergic type reaction. So watery eyes, running nose, sneezing, itchy skin, all that fun stuff. And your CBC probably also looked at immature granulocytes. So immature means that they're not differentiated yet. They don't really know what they're doing, but these cells respond when there is infection and inflammation. And that is your CBC. Next, we'll jump over to a CMP, a complete metabolic panel. Again, if you just have a basic metabolic panel, that's totally fine. You can follow along with this as well. So that first marker you probably see right there is blood glucose. We're going to skip that for the moment, and we're going to do this in chunks again, looking at different functions. So first, we're looking at kidney function. So this is going to be the BUN, creatinine, GFR, and then the BUN creatinine ratio. So BUN stands for blood urea nitrogen. And this is essentially a waste product. So it's urea nitrogen is a waste product found in the blood. So it's right in the name. And this forms when the liver is breaking down protein. Ammonia is a byproduct from the breakdown of protein, and ammonia contains nitrogen. That nitrogen is going to combine with other things, such as hydrogen, carbon, whatnot, and it's going to form a urea nitrogen. This is then going to be transported to the kidney, and the kidney is in charge of filtering out the waste product. If you have too high of a level, it's an indication that the kidney might not be working correctly. If you have too low of a level, it might actually be an indication that you're not getting enough protein. Then we look at creatinine, and creatinine is a waste product, again, of muscle breakdown. So high levels of creatinine in the blood can represent that your kidneys are not filtering this out properly. So again, think of it, these are waste products. If you have too high of an amount in the blood, it means your kidney is not doing a good job of getting rid of them, right? We want to get rid of the waste products. We're not looking at the urine for this, we're just looking at the blood. You don't want high amounts of waste products in the blood. But if you have low amounts of these waste products in the blood, it's typically a sign that you're not getting enough of whatever those waste products come from. And in this case, urea nitrogen comes from protein, creatinine comes from muscle tissue. So if you have a low amount of muscle, this can cause a low blood creatinine level. It's not necessarily any sort of disease pathology there. You might just have lower muscle mass. On the flip side to that, if you just did a really strenuous workout and then you had your blood drawn, you might have high levels simply because you've broken down a lot of muscle tissue during that workout. Your GFR is your glomerular filtration rate. If you've got the little E right in front of it, that just stands for estimated. And this has to do with how much fluid your kidney is filtering out in a specific amount of time. And you want that number to be over 90. A lot of labs will just tell you it's over 60, and so you're good. You don't have chronic kidney disease. But realistically, you want to be over 90 because between 60 and 89 can actually be stage 2 of chronic kidney disease. So you want to know if you're in that range because there are things that you can do to help bump your kidney function back up. And then you might have your BUN creatinine ratio on your blood work. It's just the ratio between the BUN and the creatinine, the two different types of waste products. So now we're going to jump into electrolytes. And with this, I will add a note about blood sugar. So a normal blood sugar, if you are fasting, is between about 70 and 99. If you are not fasting, ideally you still want that number to be below 150. But if you are within 2 hours of eating a meal, if you're up closer to 200 or even a little bit over 200, that's not abnormal because you've just eaten, so you have higher amounts of sugar in your bloodstream. 2 hours after you've eaten a meal, though, you should not have a higher level than 200. Normal levels for a blood glucose are going to be between 70 and 99. If you are fasting, low levels under 70 are considered to be hypoglycemia, so your blood sugar is too low. And then if your blood sugar is up over 100 when you're fasting, you might kind of be in that diabetic realm, metabolic syndrome, something's going on there. I would definitely recommend further testing. So your electrolytes are sodium, potassium, chloride, carbon dioxide, and calcium. Or electrolytes are actually what determines the movement of fluid in your body. So wherever there's a high concentration of certain electrolytes, water is going to want to flow there. Basically, it creates an osmotic pressure change. And so it helps to maintain balance of fluid inside and outside of your cells. So let's look at proteins in the blood. So you have your albumin and your globulin. So albumin is the main protein in your blood, and it makes up a large portion of the protein in your endothelium of your blood vessels. So it is very important for blood vessel health to have a good amount of albumin. Having appropriate amounts of albumin actually stops blood from leaking out of the blood vessel, which does not sound fun, does it? Proteins also help to transport and carry things to different places in the body. So albumin and globulin can help to carry nutrients to different places. And globulin is going to be more helpful for fighting infections and moving nutrients. If you don't have enough albumin or globulin or total proteins, that's most likely a lack of protein in your diet. It can be a sign of liver dysfunction, but it's more common that you don't have enough protein. We're going to jump right into your liver enzymes. So if you have issues with your liver enzymes, it might be more of an indication that it's actually a liver issue. Alkaline phosphatase is an enzyme that is found in many different tissues in the body, but about 80% of it is found in the liver and in the bones. And so what we're measuring is how much of this enzyme are we finding in the blood. It's normal to have some amount in the blood. High amounts indicate damage to tissue, and alkaline phosphatase is found in the heart as well as some other places, so it can indicate many different types of tissue injury, but it's most commonly associated with liver. AST is aspartate aminotransferase. This is an enzyme that's found mainly in the liver, but also in the heart, in your pancreas, and some muscle. So again, it's an enzyme that leaks out of the tissue when the tissue is damaged. So it's most commonly associated with liver disease and liver damage, such as hepatitis, but high levels of AST can also be reflected in blood work after heart damage, so after a heart attack. And then we have ALT, which is alanine aminotransferase, and this is another liver enzyme. Same idea, it leaks out of the tissue when the tissue is damaged. So high levels of ALT typically indicate damage to the liver. ALT is a little bit more specific to the liver, so it's a little bit more specific of an indicator for liver disease and liver damage. And that is your CBC and your CMP. So as always, I hope that you learned something, and I hope this video was helpful. I will be creating more similar videos going over more blood work and what the results mean specifically. I'll also, when we get into some of the funner things like hormones, be going over more specifics on what highs and lows mean, as well as in the naturopathic world and in the functional medicine world. I'm sure you've heard of optimal levels being different than normal levels, and so I will be going over that. If you like this content, please subscribe to my channel. And I would love to get questions and comments from you guys, as well as if you have any burning questions about other tests, which there are tons of that I did not talk about. I would love to answer your questions. Just drop it in the comments. Subscribe.